So again, hello everyone, the people who are connected right now live, but also the people who will watch this webinar later. My name is Franz. I am part of the Nelis and OML app team that organizes this event. And we are today with Adekemi from Nigeria. Hello, Adekemi. We will know a lot about her in the next minutes. You will see a lot of interesting field experience and also point of view. We are also here helped by Lucas from Nelis for the technical support. So just to start, let me a bit take you about the background of it. Let me just share my screen 1 second. Thank you. Here you go. That's the title of today, Healthy Lives, Healthy Planet, exploring the nexus of health and a sustainable world, which is very important in continents like in Africa. For example, we are with Adekemi from Nigeria, as I told you. And based on that, let me just present you who organizes, let's say, this event in 2 minutes. You see already the logo on the left. It's called the OML, let's say, 1 million leaders app, the OML app. It's the new big program of Nelis. It's a mobile app by people, for people, by sustainability enthusiasts and leaders for sustainability enthusiasts and leaders. Most of you, know about it, but I will just tell you the main 4 aspects of this app. The first one is that when you use this app as a user, you are able to empower young sustainability leaders worldwide, like Adekemi, but like 1,000 of people that we already have at Nelis. The idea is to join a global movement that goes to 1 million leader as an objective. This is not for fun. It's really our objective in few years from now. And we are mainly based in Latin America, Africa, MENA, and Asia, continents that sometimes are not really visible in this sustainability and innovation, let's say, world. And we believe that for sure there are a lot of people doing amazing things there, and they should be empowered and visible. So by being a user of this app, you empower this kind of person. Then by being part of this app, you can witness also what's happening in the world. Let's say by being a partner of this app, you can follow and support the activities of a lot of young entrepreneurs, but also what we call social innovators. And we already have those in more than 50 countries worldwide as a start. For sure, by doing, let's say, by being a partner and a user of this app, you can learn. It gives you access to a lot of micro trainings in the different fields of sustainability and social innovation from very different perspective and people. And the last thing, the one of today, you can belong, meaning this is what we are doing today. We are a community. We are joining the same event online, and we are organizing more than 30 annual community events online. And today, the webinar of Adekemi is part of them, and we are happy to see you here. So if you want to know more, if you don't know yet a lot, you can go to omlab.org. This is the website. You will see more details about the app. Thank you for that. Now, the day, Adekemi, the webinar today, 9 a.m. UTC. Hello, Adekemi again. I just want to tell you, Adekemi, can you tell us a bit more about you and to present you in few words, because people maybe don't know you and you have a great experience. So just present yourself a bit, and after we will go to your main presentation about health. Thank you.
Yeah. Hi, everyone. Thank you so much, friends. Hi, everyone. It's really good to be here and part of the OML webinar. And of course, I'm Adekemi Adeniyan, so Adekemi for short, and that's my first name. I'm a rural dentist. I'm a dentist by profession, and I work on the rural parts of Nigeria. I'm currently the executive director and the founder of a non-profit organization called Dentalcare Foundation, where our goal or our main aim is to make sure that people in rural communities, vulnerable populations, especially children, have access to what we call oral health, or make oral health accessible to everyone, irrespective of your zip code or irrespective of where you come from. And I'm also an environmental, like, I'm very passionate about when it comes to environment. And as much as possible right now, I'm trying to make, in terms of the work we do in dental care, really sustainable in terms of the environment. I'm also the author of a storybook for children, which promotes oral health. It's called The Girl Who Found a Smile. And it's also a privilege to be an alumni of the 1 Million Leaders Africa Fellowship. It's an amazing fellowship by Nelly's, and I would have advised any African, or because it's located in different parts of the continent, to be a part of the 1 Million Leaders Fellowship program. So I think that's it for short for me.
Thank you, Adekemi. One question: where are you based exactly in Nigeria, if I may?
Okay. Yeah, so I'm based in Ado-Ekiti. It's Ekiti State, Nigeria. It's the southwest part of Nigeria, mainly populated by the Yoruba people. So yeah, it's a
Okay,
rural
thank
part
you.
of Nigeria. Yeah.
Nice to contextualize a bit. I will share just my screen for one last time to show the program of today. Just a second, please. Here you go. So as you see, we have 20 minutes, 15, 20 minutes of learning and inspiration by Adekemi. You can all comment and discuss in the chat. You have questions. We will gather them with Lucas, who is here also to support. And we will ask them to Adekemi while she's talking at the end. Then we have a panel of discussion with a question that we have prepared with the OML app, let's say, team. And then we can go further with the participants if you have questions left, or if we enter in a conversation and a debate, why not, with Adekemi. So now, Adekemi, up to you to share your slides. The field, I would say, is yours for 20 minutes. Thank you.
Yeah, thank you, friends. So I'll just share my screen now. I hope you can all see my screen.
Yes.
Absolutely great. So thank you again for the opportunity. Thanks to ML Hub for the opportunity to present something that is really dear to my heart. And it's on healthy lives, healthy planets. And the most important thing we must understand is that there's no healthy planet without healthy people, and there's no healthy people without healthy planets. There are two sides of a coin. And that's why one of my favorite quotes is by the ex-director general of the World Health Organization, and she says a healthy planet and healthy people are two sides of a coin. You can't just take one side of the coin and not decide to choose the other side of a coin. Because the truth is, when our environment is healthy, it breeds healthy people. When our environment is healthy, people live long, people are more sustained. And it's the same thing. It's only healthy people that can sustain an healthy environment. So there are two sides of a coin. You can't do away with one and say, I want to choose one. So it's very important that we understand that how healthy we are as individuals and as the community is affecting our environment. And at the same time, how much of healthiness we put into our environment is also affecting our health as individuals. And I'll just share with you briefly what I call the environmental health connection before I go into what I call examples and things that we can boldly see. Is one of the, of course, the number one thing that everybody knows, and is the word or main thing that is being said today, is climate change. Climate change. And we can see it everywhere. The World Health Organization recently stated that if we are not careful, if we're not taking care of our environment, about 250,000 people will die between 2030 to 2050. And we're already seeing that happen. Just last week in New York, there was flooding, there was flash floods, and there were lots of damages to buildings, damages to cars. And even in Nigeria, where I live, last year there were lots of flood. We can see heat stress happening in Africa right now, in different parts of the world, in Asia. These things are a reality. Droughts, we can see a lot of famine. We can see, farmers complaining that rain is supposed to fall at a certain time, but rain is not falling, which means that they can't get good produce. And this is a reality that we have right now. So climate change, and this is indirectly affecting our health. Okay, what of vector-borne disease? We can talk about malaria, which is a major culprit in Africa. Yes, thank God to the vaccines that have been developed, but malaria has been a long-standing issue in Africa. And why is this? That's because, of course, when we talk about the climate, when we talk about pollution, when we talk about water, there are several different issues that is causing vector-borne diseases in Africa. And if we're not careful, we're saying that in 2050, over 1 billion people, over 1 billion. That is more than a quarter of the population in the world as a whole, which means that the productivity of the world is going to be affected. The economy of the world is going to be affected just because there's something wrong with our environment and there's something wrong with our health. Now, what of water quality? You still, even where I stay right now, we still have communities, we still have houses that do not have access to good water. When I mean good water, people have to travel some kilometers. People have to walk certain houses to even get water into their buildings or get water into their lives, into their homes. And the truth is, if we're looking at it in the next, like, and it's already happening 10, 15 years from now, over 2 billion people are going to be affected as a result of lack of good and quality water. And waterborne disease, we are seeing it happen in Africa a lot. It happens in rural communities, even in what we call developed countries, Asia, America, North America, Europe. We're seeing that happen a lot in terms of rural communities where there's lack of good water. There are waterborne diseases, diarrhea, cholera. Our children are suffering from it, especially in Africa. Children under the age of 5 are suffering a lot from cholera, diarrhea, dysentery, and some of these waterborne diseases because there's no access to good quality water. And one of the things that is causing this is just because our environment is not safe enough for our children. Our environment is not safe enough for us. Hence, is not safe enough for our health. And I'll just go into a little bit of examples that most of us can relate with. Malnutrition, which is common. Even as a dentist, I see a lot of malnutrition occur in the mouth for children, for adults these days, because, like I said earlier, quality foods are not being grown because why? The climate is affecting our grounds. Our grounds is affecting the food that we produce. The food we produce is affecting what we eat. What we eat is affecting our body. It's a reaction chain that is constantly and constantly happening. So we're seeing a lot of malnutrition. We are seeing a lot of obesity, even occurring from eating the wrong foods. Right now in Africa, we see people no longer have access to even good quality vegetables and fruits. You see a lot of rice, you see a lot of foods that are affecting our body in certain way. Cancer, which is one of the most common diseases right now, even in Africa. Before now, in the past 15 years, or should I say 15 years ago, cancer used to be something of, like, should I say, something that is strange in the African community. Nowadays, you even open your Facebook or you go to the clinic, and it's easy to even see a young person as young as 15, as young as 20, as young as 30, coming down with cancerous diseases, different cancers of the body. And these things are caused by air pollutions everywhere, asbestos, pollutants, different carcinogens, even in the food, in the waste products that are being thrown in our communities. These things are affecting our skin, they're affecting our bladder, they're affecting our lungs, they're affecting every part of our body. What of our children? Children are born with certain neurological diseases because the foods are contaminated, the paints we use for our body, our houses are contaminated, waste products are thrown simply everywhere. I like where I stay. I like my state. I like my community. But sometimes I walk down the street and just every other corner, there's a waste product that has been disposed wrongly. And the truth is, that's the reality in Africa and some of the rural communities where we come from. And this has to stop, because as much as these environmental issues are threatening our health, us being not healthy is also threatening the environment. And look at these statistics. I'm not here to do a lot of academics, but you look at these statistics. Africa, look at it, just Africa alone, 180 million extremely poor people in Africa. And we are being affected by floods, but we're being affected by heat, we're being affected by famine, by malnutrition, water scarcity, cholera, dysentery, malaria is killing thousands and thousands of people and taking away lots of potential. These are regions of the world that are mostly affected by climate issues, mostly affected by our environment, and it's also telling on our health. And we also understand that a lot of these potentials of lives in terms of when it has to do with health are being wasted just because we're not taking care of our body and we're not taking care of our environment. So let's look at it. Let's flip the coin. How is really how, it's easy to say, okay, yeah, I understand that my environment, I understand that throwing away a waste product wrongly can affect my health in terms of, okay, let's say there's a methane that is being released, or let's say there's a gas, let me use a gas that is just being released wrongly and it comes back to affect my lungs. It's easy to understand that, but wait, how does me being unhealthy affect my environment? This is it. The truth is, it's only healthy individuals that can take care of their environments. And that is the truth. When people are healthy, it means that people have less visit to. No, the hospitals have less visit or have less need for resources, because some of these resources, and especially in Africa, where we are still trying to get sustainable resources, some of these resources are actually dangerous for our environment. It means that if 1,000 people go to the hospital this week, 1,000 people, there's 1,000 chances of waste or medical waste being disposed wrongly that can come back to affect our environment. Not to talk of that, we're talking about transport or pollution or transport emission. People traveling to go to the hospital means they have to take a means of transportation. Sometimes that has to be a taxi, that has to be a bus. There's a lot of CO2 pollution released to the air, which comes back to haunt us. So at the same time, we also understand that when you have an healthy lifestyle, it's easy for you to say, I want to grow my food because I'm healthy. Is an healthy individual that wants to get involved in farming. Is an healthy individual that wants to get involved in exercise. Is an healthy individual that wants to get involved in cleaning up my environment. So when I find myself unhealthy, I'm not motivated to do the things that will actually clean up my environment. And much more, I'm not conserving all the efforts. I don't have the zeal to advocate for a better environment, because what does it matter? After all, I'm not even healthy to do that. Why should I have to advocate for a conservative or a good environment? So it's very important that we take care of our body, to take care of our environment, to take care of ourselves. Like I talked about, it's just a circle that keeps happening and keeps happening. Because if you go to the hospital today, you can't tell hospital people, hey, we are advocating for our environment. Come and join us. Let us do a beach cleanup. Let us do a community cleanup. Let us do a market cleanup. No, nobody wants to get involved in that when they are too unhealthy to do that. And now let's look at some examples where these things are a reality. We look at India, it's not just our health affecting our environment, it's also affecting our economy. No, diabetic patients is on the rise, not just in India, in Nigeria as oh, it's also on the rise. It means hospital visits are increasing. Hospital visits, like I said before, means transport emission. Transport emission means that a lot of pollution are released into the air, a lot of waste product, a lot of misproductivity. And in Nigeria, look at Nigeria for an example. Nigeria has 15% of patients that are hospitalized. These 50% are likely to come back with what we call healthcare associated infections. It means that as an unhealthy person, I go to the hospital. Yes, I'm being treated, but at the same time, I come back with something different from what I came in with, which is also a challenge, which means that, for instance, you go, because you're not taking care of your environment, you end up with dysentery or you end up with cholera, and you go to the hospital, you end up with cholera, but then you end up taking a bacteria that causes tuberculosis or something else. It's just a circle of effects if we don't take care of our body, if we don't take care of our environment. And of course, we're talking about Brazil. Look at the resources that are being wasted in terms of as a result of unhealthy people. United States States, of course, one of the #1 countries when it has to do with obesity, which has to do with poor food, like, it has to do with, see, a lot of gallons of fuel are being wasted because a lot of people are traveling to places where they have to get care. And not just that, obesity is known for sedentary life. It means that people are not doing a lot of exercises. There's a lot of pollution everywhere. Pollution links deaths in countries. And of course, in Japan, which used to be one of the countries known for good eating, good food. And right now we are seeing a dietary shift, entirely a dietary shift. And people are shifting more from vegetables and naturally grown food to fats, to sugar, to animal produce. And this is affecting our health and automatically affecting our environment. So it's very, very important that we see these examples and see the realities in our communities. I see it in my communities every day. Even though my community, or should I say my state, is made up of farmers, we still see some of our farm produce being exported to other states or other places. And we see a lot of people still consuming processed foods, even on the streets, in the market. We see a lot of waste produce being disposed wrongly. And now this is it, because it's not just about complaining and saying, oh, I want to be healthy, I want my environment to be healthy. What can we do as individuals? What can we do as a community? What can you do in your place of work? What can you do in your organization? And these are things that you can do. #1, we can take, especially when we want to make sure that our health is not affecting our environment, we can take preventive care and education. Because, the truth is, right now in Africa, the reality is our health systems are getting better, but they're not where they should be. I've worked in hospitals, I've worked in clinic, I've seen the realities of things, and sometimes we may not get the best care that we want, and that in turn affects us. And the truth is, prevention is always better than cure. It's always better than cure. So what can we do? While we are working on our health systems to get better, we can teach people and advocate people and educate people, not just on health education alone, but how environment affects our health. Not just on environment alone, but how health affects the environment in a whole. So, for instance, people must go through regular checkups, screenings, checking for diseases, checking for things that, and this must be done on community level to also ensure that it's not affecting our environment. For instance, if people in my community have to travel 5 miles just to get quality health education, then is that really prevention? Are we really actually taking care of our environment? Because it means that when we're talking about this preventive care and health education, it must be hands-on. People must be able to sit in their homes and they're not affected by the zip code where they came from. It doesn't mean that when you come from a rural community, you can't get quality preventive care or health education. So it's very, very important. And nutrition advocacy. I know that times without, and World Health Organization have said, we're advocating for homegrown foods, gardens, farming. Farming is a major thing happening in rural communities across Africa now. But the reality is most of this farming are done in the bid to actually get money for the family or for the individuals. Most of them don't even end up probably eating the produce or what they produce. And the truth is, the more we get involved in eating plant-based foods, vegetables, fruits, the more we lower chronic illness, diabetes, heart diseases, cancer. The more we lower those things, and much more, the chemicals that come from all this processing and processed foods is affecting us. So the more we get involved in actually gardening and farming, the more we create an emission-free community for ourselves. Meat production, there's a lot of meat production. We see that happening in Asia. We see that happening in Africa. It's the reality of Africa. It's not just about the meat production. It's that even the dispose and the waste from this meat production are being disposed wrongly. And this is even affecting our farms. It's affecting our water. Some of these things are being thrown in the nearby river, being thrown in the nearby water, being thrown in the nearby farm. So affecting even the quality of fruits and vegetables that are being produced today. So not just advocating for nutrition advocacy, but taking care of our farms, taking care of our environment. And one of the things that I'm an advocate for is what I call telemedicine. It's very important. We may not know how telemedicine is affecting our environment, but it sure is affecting our environment. As much as we do not all love COVID and the effects of COVID, one of the things that COVID did was it advanced telemedicine. And during that period, there was little, should I say, a decrease in CO2 emission from transportation because there was limited transportation and people were receiving consultations online. There was improved access for patients irrespective of their geographical location. So it's very important that if we actually want to, bridge the gap between environmental sustainability and medicine and health, telemedicine is a key to this. It's very important that we be able to bring telemedicine together with our environment, because the truth is not just that, the doctor is not traveling, the patient is not traveling, there's no transport emission, there's no energy being misused, there's no waste product, and let me give you an example of the reality in Africa. As much as telemedicine is something that is growing right now in rural communities of Africa, in rural states of Africa, and let me use Nigeria, let me just not generalize Africa, let me use Nigeria as an example. The reality is these days you still go to a regular clinic and you find out that the doctor is still writing on a sheet of paper because they're not using technology, they're not using the computers, they're not using ways where they can transmit electronic records. And that's the truth, which means that we are wasting papers, more trees are being consumed to produce those papers and are being transported. And there's a lot of waste being produced just because we're trying to run a regular clinic. Of course, I'm not saying we should should I say substitute face-to-face consultations with telemedicine, because there's still a need for that. But as much as possible, we must reduce things that are not really necessary to have contact in terms of when it comes to healthcare. So telemedicine is the key to that. Now let's look at health initiatives that we can, there are a lot of healthcare initiatives that can change our environment, that can change our world one community at a time. I'll do a little bit highlighting with the organization I work with, and also with a project I ran with my my homeless stars, which they were part of the 1 Million Leaders Africa Fellowship. So I work with Dentalcare Foundation, and I mentioned really that our aim is has to do with oral health, but we also understand that when it has to do with oral health has everything to do with your body. Your mouth is the portal to your body. Most people don't know that. Just say, oh, I have diabetes. But do you know that one of the first signs of diabetes show in your mouth? I have HIV. One of the first signs of HIV show in your mouth. So it's very important. And one of the things that we are doing as an organization to foster what we call eco-friendly, or to make sure that our environment, like in the bid to advocate for oral access to oral health, we are not making our environment worse, is distributing what we call the eco-friendly toothbrushes. Did you know that one toothbrush that you use, just one toothbrush that you use, and hear this, do you know that as an individual, you're to change your toothbrush every 3 to 4 months? So it means that as an individual, normally you should use about 3 toothbrushes, or at most 4 toothbrushes in a year. But it takes over 1,500 years for one plastic toothbrush to decay. It means that 4 toothbrushes that you're using in a year may never decay in your lifetime. So in advocating as an organization, in advocating for oral health, we can go about distributing free toothbrushes and say we are doing good. But at the same time, this is coming to tell on us. Because this is coming to tell on us, when people go down with diabetes, their oral health is being affected. When people go down with cancer, their oral health is being affected. So it's very, very important that we are not creating the circle of problems just because we are creating initiatives as an organization. And one of the things that my organization is also doing right now to kind of look at how we can create a sustainable environment is not just distributing eco-friendly toothbrushes, but getting communities to, or getting individuals to donate their plastic toothbrushes to the organization and using them as a means of art initiatives to create home decors, to create any arts, or for children to be able to create arts. That way, we are creating a circle of healthy environments. This is just a picture of, you can see the eco toothbrushes. They are made from bamboo, which are easily accessible. And these children, there's no how you use this, and there's no how you use this and you feel like, okay, my community is being affected wrongly just because I'm trying to distribute toothbrushes. Now, using art to, and this is one of the preventive, I talked about preventive education. One of the things we believe in is reaching out to children early, making sure that children are champions of oral health messages, because we believe that children can take the message across everywhere to their families, to their schools, and all that. So as much as possible, we meet them where they are at, using art, using music, using fun ways to actually educate them. And one of the things that we also did as an organization, especially during the COVID, is to create a teledental kiosk, which I talked about telemedicine, avoiding people having to travel. And this teledental kiosk and this teledental center is being supplied by solar, which is a very good energy conserving source. That way, we are not creating too many problems. Are you getting my point? So for instance, it's not even just about saying, oh, we want to establish telemedicine, we want to do AI, like we're talking about. What source of energy are we using to do this, so that it's still not coming back to our environment? So we must make sure that all the processes in itself are environmental friendly, not just the results. Sometimes we want to put the results out there and say, oh, our results are environmentally friendly, but what processes are you going through to make sure that these environments are friendly? And of course, I'll just talk a little about the project that I did along with my stars in the 1 Million Leaders Africa program, this is a market in Ado-Ekiti. A market in Ado-Ekiti. And look at a market in Ado-Ekiti does not have a proper waste disposal management. They don't understand recycling. They don't understand segregation of waste. And this is a market where we buy our food. This is a market where I'm going to likely go there to buy my meat. It means that I go to this market where there are a lot of flies, there are a lot of, vectors that are feeding on the waste, coming to perch on the food that I'm going to buy. I take it home to cook, then I come down with diseases. Can you see the ripple effect that this is communicating in our environment? And the truth is, this is just the reality of many markets in rural communities in Africa, in rural communities everywhere. This is just the reality. Improper waste management. And because this waste management were not properly disposed and not properly segregated, the market women themselves are being affected, which means that, of course, in terms of their productivity as even coming to the market when they are healthy or unhealthy is being affected. The community and people in the community are also affected. So we can see that it's very important that, through this let's say program, my stars were able to educate market women on how to segregate their waste, give them waste bins for them to be able to segregate and separate, taught what it means to recycle, taught them the difference between a wet waste, a dry waste, and an hazardous waste, which was a very productive training for market women, because this in turn created a cycle of health for us. Now, let's go to the reality, because I see like we're talking about AI and all that. What is the way forward? What is the future? The future is now. And the way we can create an healthy environment is for us to have green healthcare facilities. There's no two way about it. Yes, and I can't say it is far-fetched in Africa. It's not far-fetched anywhere. It takes individuals to begin to take action one step at a time. It takes organizations to begin to take action one step at a time. It means that our clinics, our hospitals can be more green, can be more eco-friendly in the things we engage in, the resources we used, our facilities can be trained. As someone who went through medical school, it's so alarming that I never went through a course that taught me how to, recycle as a medical person, how to dispose of medical waste. No, we were just taught
Adekemi,
that, okay, Yeah,
Adekemi,
can you
sorry,
hear me?
just you have 2 minutes more or less now. It's already
Okay.
30 minutes. So
Yeah.
thank you.
Absolutely. Thank you. So it's very important that as medical professionals, we don't just imbibe that in the culture of training. We train medical students on segregation of waste. So those medical students can come up to develop great healthcare facilities. And of course, using AI, AR, VR in healthcare is very, very important. When we're talking about telemedicine, we're talking about diagnostics. Diagnosing without people having to go to the clinics is a very, see, these days, working with people with disability, using virtual reality, making sure that as we are creating an healthy environment, we are also making sure that this is accessible to everyone. It is very, very, very important. And this is what I will say. A healthy outside starts from the inside. You know, these days we hear a lot of people advocating for healthy environment, healthy care, healthy this. Let's dispose our waste, let's dispose this. But it starts from you. It starts from how you take care of your body and how you take care of your environment. It starts from how you mobilize your family. How you disposing your waste in your house? How you taking care of your body so that it doesn't affect your environment? So it's very important that the change, it starts from you and it starts from the inside. So I think I'll leave us with this today. And thank you very much for really listening and being patient through the presentation. Yeah, thank you.
Thank you very much, Adekemi. I was astonished by the numbers that you give, which are sometimes very frightening. And one of the, I think, key word of your presentation and of your work, it's ripple effect, showing to local
Mhm.
governments, people, and communities that when there is no health, there is a lot of social, economical, negative impact. And so you have to engage for the health, not only because it's good for the people, but because it's good for everyone. And in order to engage for the health, you need to engage for the environment. I am sure a lot of fellows will be inspired and maybe try to replicate for sure in their own way, or at least to include health aspect into what they are doing, because it's key. And I am, even me, very impressed by that. We had a nice conversation in the chat because some solutions are already happening in India, for example. Anyway, now I will share my screen again. Thank you, Adekemi, because I have some
Mhm.
questions for you. Let me just share my screen, just a second. Here you go. First question. So you are a mobile dentist and also an
Mhm.
environmental, I would say, activist. We have seen that you have a unique perspective on the link between health and sustainability. So I wanted to tell you, you already started to answer, but maybe even more concretely, do you have tips? Let's say one main tip for individuals and communities, especially in rural regions, whatever in Africa or somewhere else, for them to maintain good health, but also by minimizing their environmental impact. Something they can do easily, concretely, that can do both. Could be amazing.
Yeah, thank you, Franz. And I will say this, that the truth is, when you talk about rural communities in Africa, the number one thing that you do that would first, that you don't even need, should I say, doesn't is not financially costly, that would help you take care of your health, and at the same time your environment, is recycling. Proper waste management. Even if you can start that in your home, even if it starts with just getting two baskets and saying, this is my recycling, I'm going to recycle all those PET bottles, I'm going to recycle bottles of water, I'm going to recycle papers, and use it in ways that could be productive for me. These ways, these days, one of the things that is very common in rural communities where I stay is what we call pure water, or should I call it, it's like a nylon that has water inside it. And people use and dispose it a lot. It fills our gutters, fills our environments. But these days, we see a lot of people reproducing shoes and bags with it. It means you're not just taking care of your environment, you're making money for yourself, you're making money for the economy. The second, I'll say, grow your food. Very important. Farming is something that is very, very achievable and feasible in rural communities, but at the same time can have affect our environments very well, because it's giving us good nutrition, good food, and at the same time, it's tilling our ground. So growing our foods, exercise, which is hard for many people, but it's literally cost friendly for many people because you can do it in your house. Because while you're exercising, you're taking care of your body, but at the same time, you're taking care of your environment. See, one of the easy ways I tell people you can exercise in your communities. Call your community members and do a waste management exercise. Speak waste in your community. You're exercising at the same time you're cleaning your community. So I think I'll stop there for now. I think you're muted, friends. Is it me?
Sorry, Adekemi. Yes, I said very
Okay.
good point because it's very concrete and I like it. Everyone can do that, and thank you. So I have a second question. Let me share again my screen. Then it's more theoretical, let's say a bit different. But how can medical practices in general, not only oral but anything, in rural areas adopt more sustainable and eco-friendly approaches? You speak about the toothbrush, for example, but how we can have a more sustainable, let's say, eco-friendly medicine without, for sure, compromising the quality of the care. And maybe both are interlinked again. What would you do?
Yeah, I would say first, and I think I mentioned a little bit of this, is we must switch from paper waste to electronic records because paper waste is one of the biggest waste in when it has to do with medical care, especially in Africa. So just switching from paper waste and using toxic materials in terms of printer inks and switching to health records and electronic health records help us a lot. Secondly, installing energy efficient lighting like solar. It's a very efficient way to be eco-friendly as an hospital. When hospitals begin to imbibe or individuals engaging in initiatives begin to imbibe the act of using solars and appliances that reduce energy usage, even in a bid to create a healthy environment. That's important. Then I will say this: purchase reusable rather than disposable medical supplies. There are so many medical supplies that we have, especially in Africa right now, that are not reusable. You just do it and do away with it. They are creating a lot of waste. Even our gowns, the blankets we use, some of the things that we use even as doctors are not, some of them, you after a while we just dispose it. It's very important that we use a lot of disposable items that can be recycled and used to do other things rather than things that are disposable and they can't be used anymore. Of course, I'm an advocate for telemedicine, so I would say telemedicine to reduce patient travel, reduce consultant travel. And I would say in terms of buying products, look for, in terms of even these days, you see pharmacies producing greener products. Look for greener packages. Look for greener, gloves that are being created with green products right now. This may be like this may not be easily accessible for rural community, but as much as possible, when there's a demand for this, I believe that more eco-friendly, should I say, producers begin to bring these things into communities like ours. So I'm an advocate for that.
Thank you. Thank you. Okay, that's nice, and it's nice to have advocates for this kind of things also in rural areas, also to spread awareness. And it must not be easy, and it's good that you exist. Let's say. I have a third question, more based in Africa. Let's say for the OMLA fellows. You showed it. Can you see it on the screen, Adekemi? The question?
Yes, yes,
Okay,
yes.
because in Africa, as you showed, health and healthcare, it's a daily, or at least it can be a daily issue for some communities. And so,
Mm-hmm.
how can community-driven and environmental initiative that must not sometimes be focused on health, but how they can
Mm-hmm.
promote better healthcare? I'm asking this because if we have, sorry, for, some fellows here, they have an environmental initiative, how they can also
Yeah.
promote better health through what they are doing.
Yeah. So this is it. I would say this that one of the ways, and I'll give two examples. I'll use an example of a lady in Nigeria that is doing what we call from water paper to creating bags and creating books and creating plates and things like that. I'll say what you can do is whatever initiative that you're doing right now that is environmentally friendly, how can you incorporate an health initiative or health factor to it? For instance, it's not just about for someone that creates, for instance, let's assume that what you do is recycling. How can you recycle produce? For instance, in the produce that you're getting for your environmental initiative, how can you recycle this produce such that you can deliver them to rural clinics? You can deliver them to hospitals, like reusable cups, reusable blankets, reusable clothes. So in your bid to make the environment friendly, make sure that you're incorporating things that are going back into the healthcare. Another thing is there's something called farm to school programs. There are a lot of environmentalists that are into farm, like into farming, into taking care of or growing things. There are ways where you can incorporate, especially these days where feeding is being incorporated into schools. Rather than allowing these schools or those children to take in foods that are unhealthy, why can't we take this produce that are very healthy from the farm directly to the schools? It means that indirectly it is changing the health of the children, affecting the environment as a whole also. So it's very important. Tree planting, we need more tree planting, should I say more environmentally friendly medical centers. For instance, if your environmental advocacy or initiative is tree planting, do you know that it's rare these days to even find a clinic, especially when you go to the urban areas and now happening in the rural community, to find a tree? And the truth is, we've also seen that nature can have an effect on the mental health of people. There is shade, there's a way for you to relax on, all these things. So you can incorporate, tree planting into hospitals, initiatives, mental health initiatives. I see a lot of horticulture or green, even let me use example like adults with dementia that has memory issues. You can use gardening, horticulture as a way to stir up their memory, as a way to stir up their mental health. So these are ways that you can bring your environmental initiatives into healthcare. Even tree planting for children, for youth in schools can affect the mental health of people. So, and there's several other cases like that. But for the sake of time, I think I'll just stop there.
No, it's very good examples. I hope people are taking notes, and in any case, you will be able to watch it again. Because, for example, what you say just about dementia is very nice. You have an environmental initiative, you can bring some people with psychological or psychical issues, and it could be very good for them. So you have a ripple effect on your initiative, tackling all the SDGs, for example, just saying. Great. I have a last question for you, Adekemi. Something a bit different. I like local cultures myself, so I wanted to ask you something about that. In Africa, we have a lot of traditional medicine that
Yeah.
relies very often on the local plants and the local practices that are passed down through the generations. And not only in Africa, to be honest, even in French mountain, my father knows things like that. So my question is, how can we find a balance between preserving this cultural heritage, but also being sure that this traditional medicine is both safe and environmentally responsible or sustainable? Do you have an example? What do you think of it?
Okay, let me first say this is one of the things that this question is very nice and straight on, because one of the things as a medical person is that first of all, you're trained to believe that when it comes to traditional medicine is against Western medicine. No, the truth is it's about finding finding the joining points or where they interline. Because like you said, when it comes to actually traditional medicine, some of the use of traditional medicine are sustainable. However, some of them are unsafe because of the ways the plants are harvested, or let's say, assume that animals are used. In the case where animals are used, that is the challenge. So I think the first thing we must do to find this balance is to identify the aspects of traditional medicine that are actually beneficial or sustainable, like the herbal treatments. Some of them are. But the truth is, if we do not identify them, if we don't know them, it's easy to critique them and say, oh, they are causing kidney disease. So we need to do more research. And much more, we need to bring some of this traditional, the people engaged in traditional medicine to a point of research and to a point of collaboration with medical professionals, with environmentalists. So they teach them, okay, how can we safely harvest our plants? How can we be hygienic about harvesting our plants? How can we be conservative, even in the bid of using traditional medicine, so that we are using conservation principles and we are sticking to it? We are not using unsustainable wide crafting techniques. Is very, very important. So one of the things I would say is encourage medical training that involves modules on traditional medicine. Encourage trainings that tell environmentalists how to bring the balance between environmental advocacy and traditional medicine. Not just saying, oh, traditional medicine is not good, using plants is not good, we must sustain it. But how do we bridge the gap? And this involves majorly training.
Thank you. Thank you. Okay, that's a good point, because sometimes we are a bit afraid of medicinal traditional, but at the end of the day, most of the time, it's the most sustainable and environmental friendly, because there is direct connection, let's say, with nature. So thank you, Adekemi, a lot for today. Maybe we have questions from the audience. What I have seen is that we have Chepo, who is very active on the chat, and who asked this, not exactly question, but who had a comment on indigenous healthcare practices that can assist in the health sector to be more sustainable. So anticipating a bit my question and your answer. So maybe I want to ask, without knowing if it's okay, but Chepo, do you want to share maybe your own experience from your own region? If you want, if you don't want, it's fine. Are you here, Chepo?
Yes, okay. Greetings, everybody. My name is Tepo Mukhadi. I'm an environmental health practitioner by profession. So I'm very touched by what Ade has just shared. Most of the things that she has shared with us is actually what I'm practically doing on my day-to-day. So I can actually connect with what she has just shared. Now, I just wanted to share maybe on the initiatives that we are doing, because what she has said is more of the theory, but we are doing it in practice. For an example, she talked about water quality. What we are doing, I am the one taking the samples to ensure that the water is being maintained, the quality is being maintained. That's my part of work. The unfortunate part is that I am based at the facility, so I cannot extend my services to my community. That's where my challenge is. But remember, it depends on where you are based. But I would like also to share what I am doing maybe at the facility to promote environmental health. One of the things that we are doing as well, we've got what we call the Global Green and Healthy Hospitals Network. She talked about global green in the health sector. We've got a network which is well established under Healthcare Without Harm. Currently at Bongani Regional Hospital, where I'm based, we have two initiatives that are running. One of them is called the IPM strategy. What we are doing here, we are trying to move away from using harmful chemicals to conduct pest control within a facility. So the IPM strategy is one of the strategies that I can share with colleagues. And these strategies are easily adoptable, are easily replicable. So I can share a strategy, you can do it in your facility or wherever you are based. We also have what we call the EHIS strategy. Now, this is like an AI. She talked about AI, artificial intelligence. So what we are doing, everything, every inspection that we are doing, it's now an app-based system. So I would like to say in closing that whatever that Ade talked about, it's actually happening in some of the areas. And I'm confirming that from South Africa now, to say in South Africa, we are actually doing it. And I'm glad that it has been shared. And I've actually noted some of the advocacies that are happening all over the world as well. Thank you. That was just my reflection. I'm happy to be.
Thank you, Chepo. Very nice. South Africa. Sorry, Chepo. Chepo, we lost you. Anyway, it was a very interesting South African perspective on that. Thank you, Chepo, again for sharing what you are doing. As a conclusion, I am quite happy and proud to see that maybe there is a shift happening, because in the health sector in the last 20 years, in order to engage for health in Africa, for example, you had to replicate what is happening in other countries which are said more developed in this way. But now I see it's a mix of both, because it's also the comeback, or at least the focus on what we know to do here with our own way of doing and our own plants and medicine or whatever, which is crucial, I believe, so for a sustainable and diverse future aspect. We have a last question, and after we end, from Mang. Do you have any plan to protect environment in any individual community? Maybe it's a question for you, Adekemi. Right now, do you have a concrete plan that you can share, maybe like best practices that you can share after, for sure, this webinar? That's the question of Mang, if I understood it well.
Okay, if I understand correctly, I would say that I wouldn't say there's a concrete plan, but one of the things that my organization as a whole, and like Tishipo said, is that just trying to incorporate that environmental factor into every of your initiative, just thinking it, getting the members of your organization to think it. And because even though my organization is not a full-fledged environmental organization, it's more of an health organization, but incorporating that bit into it to ensure that every community that we serve is being served in a healthy way so that it doesn't affect our planet. So I guess that's just it for now.
Thank you. Yes, this is the kind of question and answer. Maybe there is not exactly a specific plan that is made for everywhere and all the sectors, but still, I think today we had big inspiration and also very concrete numbers that we can share in our own projects, because the numbers that you share at the start are astonishing again for me. I was shocked. So thank you, Adekemi, for making us aware of this very important connection, nexus between both of those topics and sector. And thank you, people, for connecting today, and the people who will watch also this later. I wish you a good day, a good night, or whatever, a good morning, anywhere where you are. Thank you for your question, and maybe the very last word for you, Adekemi.
Yeah, I'll just say that, and like People said, I just want to re-emphasize something, that you may not be able to go into your community like to affect the change, but you can start where you are right now. You may not be able to go into the 1,000 communities to affect the change, but you can start from advocating where you are in your place of work. What are you doing to create a greener environment? What are you doing to create an healthy planet? What are you creating to be an healthy individual? So that's just my word for you. Think on this, reflect on this, and make sure that you practice it.
Thank you. Nice words. Bye-bye. Bye-bye, everyone. Bye-bye. Thank you.
Bye, everyone. Thanks for joining.
Bye. Bye, everybody. Thank you very much.
Bye.
Bye.
Thank you, everybody. Bye. Take care.
Bye, everybody. Bye. Thank you so much.
Yeah.
Bye-bye, Adekemi. I need to leave. Bye-bye.
Hello. Can you hear me now, anybody?